right. A little bit of a late start here tonight. It's Monday. Facebook Live, Ask the Doc. It is 10 p.m. here in Michigan. So a little bit of a late start. So for those of you who are interested in this today, just want to go over one topic that really I've been asked a lot about, and that would be workplace ergonomics. So I've been getting a lot of questions about this and how to be safe in the workplace, what to do with certain situations, how should setup be, all of that. So one of the most common questions, that I get is, especially from people who are working a desk job for 8+ hours a day, they're sitting, and a lot of these people tend to have back pain or neck pain, and they want to know what to do to fix it and how to still function in their job. So one of the things that you can definitely do is obviously change your setup, your workplace. So some of the most common things that I recommend we're going to go over right now. So one of them, if you're working at a computer, and one thing you want to make sure that is, especially if you're dealing with neck pain, is how your computer is set up and where that monitor is. So really, you want that monitor at or above eye level. If you were to sit straight up, nice and tall, you're looking eye level, you want the center of that screen at or above eye level, and only slightly above. And what that's going to do is that's just going to force you to stay upright more. So if you have it below eye level, or if you're working frequently with a laptop, like I can tell you with my moving setup at work, if I were to work at my laptop all day long, I would end up for sure have neck and low back pain because I'd be slouched over and hunched for a prolonged period of time. And not that slouching is bad. Slouching is not bad. So everyone gets it in their mind that, I have bad posture, I have bad posture. There's really no such thing as good posture, bad posture. Hey Cindy, one of the things that you want to be able to make sure that you can do, though, is go in and out of various different postures. That is what's important. You should be able to do that. Now, if you're stuck in one specific position for a prolonged period of time, yeah, you're going to have pain. Even if you're in good posture, if you're just sit straight up and not, hardly move at all and not adjust yourself, you're going to be stiff after that and you're going to have pain. So you should be able to move in and out of various postures. Our spines are meant to bend and rotate and twist and all that, and all of that is fine as long as you're doing it right and everything like that. So that's definitely one thing I like to educate on. I know Cindy, I think, had a question. Cindy, were you calling in? Let me see. Oh, I can add you on. I know you had a question. Okay, we're adding. So let's see how this works here. It says it's adding. So I'll go over the other things right after. Oh, declined. Okay. If you want to add back on, just simply click to add and I can add you. So the next thing that I'd make sure you're looking at doing is, as far as for your keyboard setup, so you really want your elbows and wrists, you want your wrists on the table, you want a slight extension to the wrists when you're typing at the keyboard. You want your elbows bent at 90 degrees close to your body. You don't want the keyboard way out in front of you. So again, slight extension with those wrists and elbows by your side. The other thing is you want your feet flat on the floor, and you want your knees slightly below hip level. So your chair height should allow for your knees to be slightly below with feet flat on the floor. If for whatever reason your chair can't raise or lower to fix that, you could always, if your chair is too high, use like a stool or something under your feet to help with that. And one thing too, to kind of going back to the monitor height, if you don't have a adjustment where you can raise and lower the monitor, you could always take two and put some books under the monitor to help adjust that level there. So usually I'll, if you have a old school phone book laying around, you can usually use that. So that's something those phone books are good for, because I don't know anyone that uses a phone book anymore. But if you have that, that's something. Yeah, those are really the three main things. Making sure you have good lumbar support too for the low back. You can put a towel behind your back. If you don't have a chair with good back support, you can roll up a towel, put that behind your back. And also, I'm going to be doing a video on this that I will post to show a setup better. I don't have in my house here a monitor or good desk setup, so I will do that later when probably here this week, probably tomorrow, and post a video of a good setup for everyone. So that way you can see that if you have questions. So I have been getting those. So Cindy, I didn't know if you wanted to. Um, but yeah, those are definitely some of the main questions that I get there. And if you have any other questions about your workplace setup, feel free to reach out, message me, ask me. I'm more than happy to answer those questions. I don't know if this isn't quite working, but I do know that there's been questions too. I've gotten this quite a bit as far as this is not quite with workplace setup, but with cervical traction. And is those traction units good? They can really help relieve symptoms. So when I say old school ones too, you'd be seated in a chair and it'd pull you up. I know, one that was just brought up was one that has it's a blood pressure cuff and it's got 3 different rings and you pump it up and it helps to bring some pressure off your neck. That can be beneficial for symptom relief and for helping with pain relief. It all kind of depends. It's definitely not going to typically cure your neck pain, but it can help relieve symptoms and be one of the tools, along with some corrective exercises, to help with that neck pain. As long as that, if, for instance, you have symptoms, numbness, tingling, shooting pain going down into your arm, if that helps to relieve it and bring it out of your arm towards your neck and get rid of it, then that is something you can use typically you need a doctor's prescription or a physical therapist recommendation on that. I don't typically recommend them a lot, just because a lot of times there are different exercises that I can give that will do just as good of a job, if not better. I am always giving corrective exercise techniques that will not only take the pain away, but keep it away and help to fix and correct the problem that is persisting. So everyone's a little different, so I can't, everyone's problem is different regarding is a traction unit right for you? It kind of depends. But if you're getting those symptoms and that seems to help, then yes, I'd say, more than likely it is a good thing for you to have, and it might help with your symptoms and might help you better tolerate some corrective exercises. I do know I have a patient that I was literally just seeing. I'm going to be trying to get her a traction unit that's covered through her insurance, because traction seems to really help. So instead of me having to traction her every time that I'm over there, she can do it on her own, and then we can focus on different things while I'm there that she can't necessarily do herself. Not a problem, Cindy. I hope that answers your question for you. So, yeah, I know that you'd had that. So if you have any other questions, definitely feel free to message me about it. More than happy to answer those. And again, if you have any questions for a future Ask the Doc, feel free to ask me. I'm always using